Today we are going to cover the Horse First Aid Badge. This is a multi-level badge surrounding horse health and basic first aid knowledge. In this badge you will cover how to treat minor scrapes or injuries, and level 2 we are going to learn about common horse illnesses and common identifiers for each. With level 1 we are going to be going over how to treat small cuts and talking about how we can treat other small nicks and sores. First, for small cuts and nicks, Vetericyn is going to be your best friend. This is kind of like an all-encompassing sort of healing spray for this sort of thing. First, I like to clean it off with some water and wash all the dirt off and make sure nothing gets infected. Then I like to spray some Vetericyn on it, and then in a couple of days it should heal up. If you want to help prevent scarring for anything slightly bigger, you can also use Vaseline after it's closed up. As far as sores go, I would recommend first using a product called Wonder Dust to dry the area out so that it stays sanitary while healing. Next, after it is no longer raw, put coconut oil over it to promote hair growth. In level 2, we will be going over some common horse illnesses and vital signs. And 3 common illnesses we will cover will be colic, ulcers, and lameness. So for number 1, colic. Colic in horses is defined as abdominal pain, but it is clinical symptoms rather than a diagnosis. The term colic can encompass all forms of gastrointestinal conditions which cause pain. There are many different types of colic, some being impaction colic, gas colic, colon shift, poor blood supply to the gut, and poor mobility. However, they all pretty much will have the same warning signs such as lying down or rolling, frequently looking at their side, excessive pawing, passing no manure, and heart rate is over 45 to 50 beats per minute. Next is ulcers. Ulcers are sores forming on the stomach lining of horses. This can cause pain and sensitivity around the barrel of the horse. Some common symptoms can include, but are not limited to, poor appetite, dullness, attitude changes, decreased performance, reluctance to train, poor body condition, and poor coat condition. Last one is lameness. Lameness refers to the condition of being unable to walk because of an injury to the leg. It can be caused by many things such as ligament injuries, abscesses, arthritis, fractures, and muscle sprains, and etc. Vital signs. It's definitely important to talk about horse vital signs and how to determine where your horse should be in terms of their physicality. The approximate heart rate of a horse should be anywhere from 28 to 40 beats per minute. The approximate respiratory rate should be 8 to 14 breaths per minute, and the approximate temperature should be 99 to 101.5 degrees Fahrenheit. Other facts you should know. Horses drink between 5 to 10 gallons of water a day. If you don't hear anything coming from a horse's stomach, it may be an indication of colic. A horse's gums should be salmon pink. To see if a horse is dehydrated, pinch their skins. If it forms a wrinkle that doesn't go down in 5 seconds, then they are. A horse's respiratory rate should never exceed its heart rate. To complete this badge, you must complete both level 1 and level 2. First, for level 1, demonstrate to your trainer or volunteer how to properly clean and treat small cuts as well as sores you may find on your horse. For level 2, complete the common illness worksheet found in your binder. When completed, have a volunteer or trainer look it over. Once you're done with that, then you should have earned your Horse First Aid Badge.